and welcome back to 90 Seconds Healthcare. Our topic today is on digital health, a brief intro on artificial intelligence, one of my research interests. I hope you'll find it interesting. This is kind of more of an urge to know about the topic, to collaborate, and I will be having a series of lectures and discussions on the topic of digital health. So, healthcare needs to be more of a healthcare, not sick care. We don't have to wait till someone gets sick. We need to be more proactive and more reliable. And healthcare is full of big data that can help us in making predictive models and can help saving lives of patients locally and globally. As you can see in the past, this is how we used to do things in a factory, but we moved remarkably. Now this is where we are, and there's no reason why healthcare couldn't be even more advanced in view of the importance of the of healthcare. Artificial intelligence goes to the background of algebra, the 0-1 concept, as we're talking about computers that can do work similar to the work of a human being. And many times we forget to give credit to Al-Khwarizmi, who is the father of algebra. And very importantly, this is where algorithm comes from. In healthcare and life, I probably use the word algorithm 20 to 50 times daily. And algorithm goes back to the Al-Khwarizmi, in case you didn't know it. So the man who invented algorithm also led us to understand computers more and advance with computers and hence artificial intelligence. Few terms, again, I said I'll be discussing this a lot more in more details in the future, but artificial intelligence in a most simplified way is having computer systems that can simulate the work of human beings. Machine learning in a very simple way, and we can do a lot more to discuss it, is learning without being explicitly programmed. So we call it machine learning. And then deep learning is learning through neural networks. And in the next series, I'll be discussing this in extensive details. What's the purpose of my brief presentation today? The purpose is to reinforce that we are having big data that if used appropriately, we can go to places with it and we can do work that has never been done before in healthcare and otherwise. As we advance, we will discuss more the CNN and the GAN, which I will discuss later, and we'll go in details over this. Some of the work we've done so far is we've looked at artificial intelligence in the safety context. We'll look at artificial intelligence and how it can improve flow. We've looked at artificial intelligence and how it affects diabetes, and I'll have special sessions on these things. We've looked at artificial intelligence in the days of COVID, and we can also learn a lot by discussing this as to any pandemic that can face humanity. We also looked at it in telehealth and telemedicine. We've looked at it from the side of blockchain, which is something I will be discussing again in the next few series, and how we can do clinical trials in a more efficient way, effective way, and have really strong scientific data. We've looked at it in the clinical trial concept again. We've looked at it in the safety, and we looked specifically at what we call random forest algorithm. We've looked at it in the patient safety context again. We've looked at it in many, many aspects. We also went into NFTs and how they can affect healthcare, and lately metaverse, which is our most recent interest. And this is our last paper, Healthcare Digital Technology Impact on Quality of Care, a systematic review you can all look at. What's the message of this brief presentation? The idea is to get you to be excited and interested, if you're not already, about digital health, for all of us to get involved and really to accept the clear need for change management of us getting into digital health, getting into wearable, getting into artificial intelligence, getting into blockchain, getting into metaverse, NFTs for the well-being of the patients and the medical community.